Chapter 20, Health Risks Across the Lifespan. And as an introduction, this chapter emphasizes the health status leading to the causes of death and diseases, and the health risks of children, adolescent, adults, older adults, and special needs populations. So, just one emphasis on here is that good nutrition is really essential for healthy growth and development, and prevents disease prevention later in life. So that's why we try to get mothers to breastfeeding. We try to get the nutrition going, because this is a huge influence on children developmentally. And the adolescent population is one of the greatest risks for poor nutritional health. Also, we want to make sure we have immunizations have been completed to help in prevention of diseases. And many times the barriers to one of the barriers to immunizations can be socioeconomic status, and we'll talk about that a little bit further as we go along. Also, we're going to talk about accidents and injuries in these age groups as a major cause of health problems, and many of these are preventable, and so nurses are in that great position to be able to help people across the lifespan to prevent accidents and injuries, and through teaching and anticipatory guidance. And also, nurses are very much involved with home-based services related to all of these different areas, from children to older adults. Children health and major public health issues. Obesity is one of the ones that you hear about so often, and it definitely is a problem, and although it is certainly receiving a lot of awareness due to the campaign from the First Lady Michelle Obama. But some recommendations include breastfeeding is associated with a lower risk of childhood obesity. It is the parent's responsibility to provide healthy meals and snacks, so parents have to be well informed. And you'll learn about a lot of these things also in when you do pediatrics, but we really want to limit all fruit juices and sugary beverages. These are calorie dense and empty of a lot of nutrients. And appropriate beverages for children are milk and water only. For children and preschoolers, it sometimes takes, you have to get them to eating a lot of different foods, and so parents need to learn to be consistent with that, so that they'll learn to eat healthy choice foods of, lower calorie foods such as fruits and vegetables. And parents should be taught to avoid using food as a punishment or a reward. Children need to learn the difference between what a snack, we all need snacks for fuel, but treats are something that is totally different. Meals cooked at home tend to be a lot healthier if you can broil, bake, stir fry, or poach foods instead of frying them. And that is not, among some, some ethnic groups, fried food is, what people prefer. But if children learn that at an earlier age, then that really helps. In addition to having low-calorie, nutritious snacks readily available for kids, and getting children and families to participate and maintain regular activities such as sports, and limiting television time and sedentary time. Injuries and accidents are very preventable in most cases, and nurses are critical to that prevention. Developmentally, family is critical to the growth and development of a child, so keeping families together is something that that really should be teaching as a prevention mode. Social support is one of the most powerful influences on successful parenting, so helping families to be plugged into their community and be a part of their family, and maintain those connections, but also a part of the community. Injury and accident prevention, as far as children, motor vehicle accidents are the #1 cause of injury and death in children, and among kids that are killed in motor vehicle accidents, more than one half of those are unrestrained, so that we still have plenty of room to talk about how to prevent accidents and injuries in motor vehicles. Child maltreatment, if a child is at a high risk, then home-based services are very recommended for this, and there are some programs like this for homeless children who are in low socioeconomic groups. The outcomes are greatly improved for children under the age of 2 if their mother is visited by a home health agency. So there are a number of programs like that in the United States. Alterations of behavior and mental health problems can be, a problem even with, with adolescents, and lead to, if some of those are not, not pediatric mental health issues are not addressed, and they can't function well at school, at home, or in the community. And a lot of stressors have really increased for kids, in recent years. Kids who live in poverty, kids who live with single parents, kids that are exposed to violence, they're at a higher risk for developing a mental health condition. And only 20% of kids with a mental health or substance abuse problem ever will receive treatment. So that means that's going to go on to be a lifetime, could be a lifetime problem if it's not addressed early. And sometimes there's embarrassment or a stigma with getting a child the type of help that they need for behavior and mental health problems, but it definitely does need to be addressed, and families, parents and families need support in realizing that. Healthy concept is one of the most positive things that we can do to help a child, to help them to build and develop a healthy self-concept. Acute illnesses, a lot of those are going to be, kind of the same, but, we want to make sure that we are promoting hand washing and prevention of the spread of illness, like teaching children how to sneeze and to cough and to, wash their hands in all types of areas, but in public areas and so forth. And then chronic health conditions that children may face. They need to be looked at. Also, the amount of medical technology. I mean, we have kids at home who are home on ventilators at this time, and so some examples of some other chronic conditions in children are Down syndrome, spina bifida, cerebral palsy, asthma, ADHD, diabetes, congenital heart disease, cancer, and even AIDS. And so children with chronic health problems, they need routine health care, and if there's not a good socioeconomic status, then we know there's going to be some barriers there. So we need to make sure that that children get the follow-up that they need, they get the equipment that they need, and just to think about families, that financial resources may not be adequate to help the families. Families need transportation to healthcare services. They need some type of school activity. And so a lot of these things need to be addressed in public health in order to maintain optimum health for children with chronic health conditions. And one that's also on the rise is asthma, that definitely needs to be addressed through public health. Target areas for prevention are acute illness, such as hand washing, smoking. Prevention is the key factor. Teaching kids who never start will never have to stop, and so that is one of the is a big emphasis. And so parents need to be targeted in this education that that they should not smoke in the home. They should create a smoke-free environment, and that they should quit if they smoke. And educational programs that deal with the negative effects of smoking on children and adolescents tend to be the most effective, because kids can't visualize how this smoking is going to affect them in the future. And so that is something that is a barrier, that's psychological barrier that is there, a naturally occurring one, but we know we can address that through education. Immunization barriers are cost and scheduling around work and life events. They may prevent a child from not being completely vaccinated. Environmental health, this is an important factor. Children who live in poverty or who are homeless are at a greater risk for environmental dangers and for stress. Some legal policy and legislation related to adult health is the American with Disabilities Act that came in place in 1990, which allowed for persons to have accommodations for their in the workplace, and in public places for disabilities, and has been very important, and has been very widespread now. It has really impacted and has allowed for services and access, to buildings and schools and so forth that that Americans might want to access and couldn't previously because of disabilities. And then Patient Self-Determination Act led to a greater awareness for advanced directives such as living wills or durable power of attorneys for healthcare decisions that has helped with making healthcare decisions and end-of-life decisions for patients and families. The Family Medical Leave Act in 1993 brought forth that people could be out to care for a family member, including for pregnancies and adoption, but to take care of a family member if they have been employed by an employer with greater than 50 employees for greater than a month, they are entitled to be able to go out on family medical leave. That does not mean they would be paid while they're out on family medical leave unless they have, the vacation days or the sick leave to do that, but it does mean that they can do that and still retain their jobs. They won't lose their jobs while they're out. Personal Responsibility and Work Opportunity Reconciliation Act was under Bill Clinton's administration, and what it did was to it looked at there used to be persons who stayed on aid to families and dependent children, and or who stayed on what people call welfare, or who stayed on a public assistance check for a lifetime. But in this, it's been limited to aids to family and dependent children. That now there is temporary assistance for needy families, and this is limited to a certain amount of time during a 5-year period of time, which I think is kind of maxes it out, and then only so much at a time. They can only be on it so many months at a time. And then aid to family with dependent children. There are parents who have to stay home with a child who has spina bifida or has Down syndrome, and so that assistance can continue with them. And also it continues for persons who are providing elder care that they would not be able to otherwise be able to, if they're caring for a person with disability, whether it be a child, an adult, or an elder, they can stay home and receive assistance for a longer period of time. Major health issues and chronic diseases and management, the 5 I's of chronic conditions. These are some of the chronic conditions. It's just an easy way to remember it. Intellectual impairment such as dementia, depression, or delirium. A person who has immobility, a person with instability who would not be able to maintain without assistance their activities of daily living. A person who has incontinence, that can be quite debilitating, and then iatrogenic drug reactions. And I think that includes of chronic conditions, including like prescription medications, and also just the multiple medications that a person might have to be on who has a chronic health condition. Major health issues and chronic disease management of adults. Some health status indicators include to talk about here include chronic diseases. Chronic diseases, and I think I have this on the next page about smoking as being a risk factor. I think I put it on there, smoking as a risk factor. But some other chronic conditions, smoking, of course, is one of the major risk factors for major health problems, including lung cancer, heart disease, osteoporosis, and poor reproductive outcomes. And so these are things that we need to talk to families about, and to be doing anticipatory guidance and prevention and teaching with them related to that. And then heart disease is the leading cause of death among women over age 50, and the second leading cause of death among women from 35 to 39. So that is very significant. We look at breast cancer being a leading cause, but so is heart disease. Cancer is the second leading cause of death for women, and in response to there used to be like a lack of, and I think I've talked about this before, research was done on men instead on women. So a lot of the times, we didn't have, the research to match up with what the healthcare problem was to have the research on it, like hypertension in women or cardiovascular disease in women, because women respond differently to medications. They respond differently to transplants. And so now with that research being done, it's much more effective. Some other chronic diseases are cardiovascular disease, hypertension, stroke, diabetes, of course, mental illness, where there is tends to be a lack of funding and a lack of support for persons living in the community who have mental illness. And then cancer is going to impact 1 out of 3 of us, and then over age 65, 1 out of 2 of us. Also with cancer, 1 in 8 women are going to have breast cancer in their lifetime. And then weight control is significant for healthcare outcomes. A person who can lose 10% of their body weight significantly increases their cardiovascular outcomes. And if you can lose 20% for a person who is obese, then the outcomes really are much greater, with reducing anything from mobility to wear and tear on joints to wear and tear on the cardiovascular system. So that is a very significant indicator, and one that nurses can help their patients to get the resources that they need. Some major and chronic diseases for women. Okay, here's what I talked about. Formerly a lack of equality in health related to research. Now there's a major focus on women's health, and I think I talked about, but some other healthcare problems that are not talked about as much after heart disease and cancer are eating disorders, either overeating or anorexia. And there's been a recent increase in anorexia among women in their 50s and 60s, whereas it usually was younger women, but women are getting older who were already anorexic. Reproductive health certainly is an issue. Gestational diabetes, because once you have gestational diabetes, the chances of becoming a type 2 diabetic are much greater. Women who have difficulty through menopause, that can certainly be an issue for women. And then we already talked about breast cancer and osteoporosis. This is another screening that women need to have, because it can improve the mobility in later years of life in a person who is not suffering from immobility because of bone fractures. So that is significant and should be a part of the woman's regular screening. Major health issues and chronic disease management of adults. As far as chronic disease, men are more vulnerable gender with shorter lifespans, and in fact, like in newborn nursery or among neonates, that the infant males have a higher infant mortality. Men also tend to be greater risk takers. And the life expectancy for men in the United States is one of the lowest in all of the developed countries. And I'm not quite sure what that has been attributed to, but men do tend to avoid diagnosis and treatment of illnesses that may result in serious health problems. And so that is one thing. So some really common health concerns unique to men are prostate cancer, testicular cancer, and erectile dysfunction, which can be directly related to smoking. Which they advertise that in that's part of the public service announcements in Europe, is to discuss that as a part of teaching. Okay, causes of chronic diseases in adults, and I think I've already said this. Smoking is a huge risk factor it just affects every system in the body, really. Family caregiving, TLC, is training and care techniques, safe medication use, recognition of abnormalities, and available resources. The population of over age 65 is just greatly increasing because we're now in the baby boomer, which we know is going to be like by some not too far, about 20% of the United States are going to be baby boomers. So there's going to be a huge increase for demand for services related to chronic health conditions, and there'll be strained healthcare budgets, probably insurances and so forth. But the fact is that most persons, older adults, live in the community, and only the last few years of life represent a functional decline. And for every one person that is in the nursing home or an assisted living, there's like 4 or 5 more that we're taking care of in the community. So somebody is their caregiver. So caregiver burden can be quite significant. They do not get adequate sleep, rest, exercise, nutrition, socialization, privacy, support, or financial aid, or the health management that they need. So this is going to become really a larger problem in our country, based on what our lifestyle is, with having 2 income families, and our having a larger number of older adults in the community. And so nurses are going to be at a huge, they also to teach self-care for the caregivers, to help assess what all those, what those needs are, as far as, all the holistically looking at physical, psychological, social, and spiritual problems, and helping to develop the individual and community interventions that's going to help with that will help with caring for a person in the community. The chronic care model, that is, it's just a community-based model. It identifies the essential elements of the healthcare system and encourages high-quality chronic disease care, which is like, through self-management. We always know self-management is the best. That people who can develop ways to healthy ways to provide their own care. Some community care settings are senior centers, adult daycare, home health and hospice, assisted living, long-term care, and rehab. And nurses will address chronic health concerns of elders with a focus on maintaining or improving self-care and preventing complications to maintain quality of life. So everything doesn't have to be perfect. The focus is always on self-care, and that's a very important concept, and you should remember out of this lecture. And that is the end of chapter 20.